Hi, I'm Dr. Avantika Tripathi, oral and maxillofacial surgeon, course mentor dentium. Welcome to today's tutorial on suturing techniques in dental implant surgery. In this video, I will guide you through the different types of suturing methods used to ensure optimal healing and successful implant integration. Let's start by reviewing the type of sutures. So basically there are two types of sutures, absorbable and non-absorbable. Absorbable sutures dissolve over time, eliminating the need for removal, whereas non-absorbable sutures require removal after a set period. Now let's discuss the armamentarium required for suturing. So the materials required are suturing pad or a dummy model, BP handle with a blade, needle holder, tissue forceps, a pair of scissors and suture required for suturing. Over the BP handle, we can use either a 11, 12 or a 15 number blade. The needle holder is grasped using a tripod or a thumb and ring finger grasp. So in this grasp, the thumb is inserted in one ring, the ring finger is inserted in the other ring, and the index finger is used to stabilize the needle holder, and it is closed or opened by locking the ratchets. So basically there are three locks present in this ratchet, 1, 2 and 3. So after holding the needle, only one lock has to be used. If we will lock it till the 3 locks, it will squeeze the needle and it is going to distort the needle completely. This is the Adson's tissue forceps. It is of two types, toothed and non-toothed. Before beginning the suturing process, please ensure that the surgical site is clean and free of any debris. This reduces the risk of infection and will promote healing. Let's start the suturing technique. So, I will open the suture and I will start placing the interrupted suture first. So, first of all, I will be holding the needle. So, now the needle should always be held 1/3 from the swaged end and 2/3 from the point. So we have to hold it 1/3 from the swaged end and 2/3 from the point. Now I will start placing the interrupted sutures. After holding the needle, we will take the first bite. So our bite should always be perpendicular to the tissue. Then we will pass it through the tissue. We will take one bite first and then we will hold the needle like this and we will gather the suture completely and we will leave a very small end outside. After this, I am going to take another bite. The another bite again will be perpendicular to the tissue. So my needle will always come perpendicular to the tissue and then I will rotate it along the curvature of the needle. Again I will gather my suture and now I am going to tie a knot. So I will take a clockwise direction, then anti-clockwise direction and then again one clockwise direction and my knot is secured. Now I am going to cut the ends. Now I will be demonstrating the continuous suturing technique. So in this technique I am going to take bite again perpendicular to the tissue and then I will gather my suture and I will pass it from the palatal or lingual side. After passing it from the other side, I will tie my knot. After securing the knot, I am not going to cut it because it is a continuous suture. So I am just going to continue my suturing from the lingual side now. We can take both the bites together or we can take it one by one as per convenience. So I will again pass my suture from the lingual side to the buccal side. Again I am going to take a bite from one flap to the other flap. Now I am going to tie my suture. For tying, the tying process is slightly tricky as there is only one cut end. So the same end will be used and the previous suture loop will be used as the other end to tie the knot. So I will not pull the suture completely. I will keep it loose and I will hold this portion. After making a loop, I will hold this portion and I am going to tie a knot like this. One knot, two knot and three knots. So by this I can tie my continuous suture. Then I will cut the one end of the suture and the other end, this loop will be there. If you feel that the loop is very big, then you can just simply cut the loop like this. It is not going to open. And if you feel this is also long, you can cut this one as well. So this is your continuous suture technique. It is mainly used in those cases where there is a very long laceration or a long incision line. The disadvantage of this suturing technique is that if one suture gets loosened up, there is a chance of opening of the entire incision line. It is very important to cut the suture in a proper manner. So the ideal way of cutting the suture is to hold the knot and pull the suture little bit up and to cut the suture just below the knot. And then we can simply pull the suture. By this method, the infected portion of the suture that is there in the oral cavity will not come in contact with the underlying tissue. Next is our mattress suture. So the mattress sutures are of two types, horizontal mattress and vertical mattress. So first I will be demonstrating the vertical mattress suture. So for the vertical mattress suture, I will pass my first bite little far from the incision line. And then on the other side also, it is going to go a little far from the incision line. Now, after coming to the other side, I am going to take the next bite from the same side, little close to the incision line. Now we will go to the other side, again close to the incision line. And now I am going to tie my knot. So this is my vertical mattress suture. Now we'll place the horizontal mattress suture. So for the horizontal mattress suture, I will take my first bite from one side, then I'll take my other bite from the other side, now I'm going to go little adjacent to my second bite on the same side. So I am going to go slightly adjacent to my second bite on the same side. Like this. Now I am going to go back to the other side, slightly adjacent to the previous bite. Like this, and now I am going to tie my knot. Like this. So if you feel that your first knot is little loose after tightening, then instead of giving one loop, you can give 2 loops at a time. This will help in securing your knot. So I will secure my knot and then I will take another in the anti-clockwise direction and then another round in the clockwise direction, and then I am going to cut my suture. So this is my horizontal mattress suture. So in these type of suturing techniques, we can see that the suture end is not coming over the incision line, so it prevents necrosis of the margins. Now I will be demonstrating the figure of 8 suture. This suturing technique is mainly used in those areas where single implant immediate or in edentulous space, wherever we are placing a single implant. So it is not used in multiple implant areas, only in the single implant areas. So first bite has to be taken from the buccal side. So first bite from the buccal side. Then I will take the next bite from the palatal side. Then I will cross the suture and I will take it from the buccal side again on the distal surface. Then I'll come back on the palatal side. And I will tie my suture on the buccal side. So this is our figure of 8 suture. To tie the suture, we can use 3 types of knots: surgeon's knot, granny's knot, or square knot. So I will demonstrate the surgeon's knot first. So for a surgeon's knot, I will take 2 clockwise directions and I will tie my suture. Then I will take 1 anti-clockwise direction and again 1 clockwise direction. So a double clockwise, 1 anti-clockwise, and third time again a clockwise direction to secure my knot. By this, my surgeon's knot is complete and I can cut the suture. Now I am going to demonstrate the square knot. So in the square knot, the first tie is given in the clockwise direction. So the first tie I will give a clockwise direction and I will tie the knot. See, now if you will see that my suture is slipping, it is not completely tying. So this is the disadvantage of a square knot. So somebody else has to stabilize it from here, then only I'll be able to give the second knot. So after stabilizing, I am going to give my second knot in the anti-clockwise direction. Then third one again in the clockwise direction. So this is my square knot. First knot in the clockwise direction, second one in the anti-clockwise direction, and third one again in the clockwise direction. Now I am going to cut the end of my sutures. Now the third type of knot that I will be demonstrating is the granny's knot. In this, the first knot has to be given in the clockwise direction. So I will take a bite and then I will tie my first knot single clockwise direction. Then I will take another one again in the clockwise direction. And the third knot will be in the anti-clockwise direction. So one single knot in the clockwise direction, second one again in the clockwise direction, and third single knot in the anti-clockwise direction. This is going to complete my granny's knot. And now I am going to cut the suture ends. So in this I have given granny's knot, this one is square knot, and this one is the surgeon's knot. So in the surgeon's knot we have to give 2 rounds together in the clockwise direction, 1 knot in the anti-clockwise direction, and again the third knot in the clockwise direction. In the square knot, we have to give one knot in the clockwise, second knot in the anti-clockwise, and the third knot in the clockwise direction. In the granny's knot, we have to give one single knot in the clockwise direction, another single knot again in the clockwise direction, and third single knot in the anti-clockwise direction. After the surgery, instruct the patient on proper post-operative care. So tell the patient to avoid trauma to the surgical site, maintain proper oral hygiene, and visit for follow-up appointments and suture removal. Remember, proper care after the procedure ensures the success of implant and minimizes complications. Thank you for joining us in the step-by-step guide of suturing techniques in dental implant surgery. If you like the content of this video, please like, share and subscribe to the channel.